Member transportation for covered services through WellCare Stay Well. Stay Well and WellCare benefits. Emergency medical transportation is covered for all members who are enrolled in Stay Well and WellCare plans. Non-emergency medical transportation for covered services is also available for members who are enrolled in the following plans: Stay Well, Medicaid MMA, WellCare Access, Medicare D S&P, WellCare Liberty, Medicare D S&P, WellCare Select, Medicare D S&P. Emergency transportation. Emergency transportation covers ambulance services to the nearest appropriate facility that can provide care. There must be medically necessary and is furnished to a member whose medical condition is such that other means of transportation could endanger the person's health. Air and land ambulance transit to prevent permanent injury or loss of life. It includes basic life support, BLS, or advanced life support, ALS. The member's condition must require both the ambulance transportation itself and the level of service provided in order for the billed service to be considered medically necessary. Ambulance services include fixed wing, airplane transport, rotary wing, helicopter transport, ground ambulance service. Non-emergency medical transportation. Non-emergency transportation covers ground transport within the plan's service area in order to obtain medically necessary care and services under the plan's benefits. Transport may include ambulatory transportation, private automobile, multi-loading, taxi, wheelchair vehicle, stretcher vehicle, over-the-road service, fixed route transit, public transportation or mass transit, private volunteer transport except transport by a relative, commercial air carrier transport where applicable. Non-emergency transportation by ambulance is appropriate when the recipient requires basic or advanced life support services during transport in order to be safely transported. Recipient's doctor must provide supporting documentation of the need prior to scheduling. Covered locations for non-emergency transport. Stay Well and some WellCare members are eligible for non-emergency transportation to and from covered services. Covered services may include behavioral health, chemotherapy, dental appointments, dialysis, doctor's appointments, hearing appointments, hospital discharge, hospital to hospital, hospital inpatient outpatient, laboratory services, pharmacy, radiology, therapy appointments, vision appointments. Keep in mind this is not an exhaustive list. Plans may vary, limitations and prior authorizations may apply. Scheduling member transportation. Non-emergency transportation is coordinated and authorized through our vendor, Medical Transportation Management Incorporated, or MTM. Members and providers on behalf of the member may inquire about scheduling transportation to and from medical appointments by calling the numbers listed below. Information needed to request transportation. Members should have the following information available when scheduling non-emergency transportation: their Medicaid or Medicare ID number or member ID number, the complete address of the member's pickup location, the name of the treating provider or facility, address and phone number for the treating provider or facility, date and time of appointment, the type of appointment. If this is a reoccurring appointment, i.e. dialysis, etc., MTM can schedule all of them. Dialysis appointments can be scheduled for up to 6 months in advance. All other standing appointments may be scheduled for 3 months in advance. You'll need the time the member should be picked up from their appointment. If the member is uncertain of that time, the member can call the driver to advise he or she is ready to be picked up. Once the member calls for their return ride, the driver has 60 minutes to pick the member up. The member needs to stay at the provider location so the return trip is not missed. You'll also need special needs information if they have mobility limitations or additional passengers. Routine non-emergency transportation. Routine trip requests are for appointments that do not require a member to be seen right away. Transportation covers a vast array of medical appointments, for example, but are not limited to PCP appointments, OBGYN, and pharmacy. A routine ride must be scheduled with MTM at least 48 hours in advance. A MTM representative can determine if the trip is a covered benefit. Urgent non-emergency transportation. Urgent trip requests are life-sustaining that require a member to be seen right away. Urgent rides are to appointments for situations that do not require the member to call 911 but cannot wait 48 hours. For example, but not limited to, dialysis, chemotherapy, radiation, hospital discharge, etc. An MTM representative will determine if the trip request is urgent or not. Urgent requests do not need to be made in advance. Please note, same-day requests may incur a 2 to 3 hour delay based on availability. Ambulance authorizations. Emergency transportation does not require prior approval. For interfacility transfers, hospital discharges for non-emergency conditions, hospital facility personnel must contact MTM to schedule non-emergency transportation. MTM is responsible for approving and scheduling non-emergency transport as appropriate to the enrollee's medical condition. Ambulance providers who accept referrals directly from a facility for non-emergency transportation should ensure the facility has obtained a trip number from MTM in order to receive payment. If MTM does not approve the transport, the claim may be denied. How do I bill for emergency transport? Emergency transportation should be directly billed to Staywell WellCare. Staywell WellCare accepts electronic claim submissions through Electronic Data Interchange, or EDI, as it is the preferred method for claim submission. All claim submissions must include the following: payer-issued tax ID, the provider's NPI, a valid taxonomy code that most accurately describes the services reported on the claim. If EDI is not available, paper claims must be submitted to Staywell WellCare on a CMS 1500 form. You can send that directly to WellCare Health Plans Incorporated, Attention Claims Department, P.O. Box 31372, Tampa, Florida 33631. And if you need more detailed information on Staywell WellCare claims processes, you can view that at the links listed below. How do I bill for non-emergency transport? Non-emergency transportation should be directly billed to MTM, including non-emergency transport via ambulance. Ambulance claims must be submitted to MTM on a CMS 1500 form. Claims must be accompanied by the following: a completed patient care report, PCR, certification of medical necessity form, the CMN, and it must be signed by an authorized personnel. If transportation provider is not contracted with MTM, the provider must also submit the Medicaid or Medicare ID number and a completed IRS form W-9. Paper claims can be sent to MTM at 16 Hawk Ridge Drive, Lake St. Louis, Missouri 63367. Attention ambulance claims. Or can be faxed to 1-800-722-0129. Attention ambulance claims. Appropriate diagnosis and CPT codes. To avoid delay in payment, claims must contain proper diagnosis and procedure codes for the applicable program being billed. Providers must bill in accordance with the Florida Medicaid Transportation Manuals, the CMS Ambulance Claims Processing Manual, or a combination of both as applicable. CMS provides guidance, and ambulance portion of the CMS manual is about conditions that reasonably permit the authorization of emergency and non-emergency ambulance transportation. The medical conditions list and instructions may be accessed at the links below. Resources are also available. Both MTM and Well Care abide by the Medicaid and Medicare guidelines. And for more information on limitations and billing processes, you may access the handbooks below. There's a Medicaid Provider Handbook as well as a Medicare Claims Processing Manual. For additional information on ambulance services and the MMA, including frequently asked questions, you can refer the following document. Frequently asked questions. Can ambulance provide non-emergency transportation to members, for example, from a nursing facility to doctor's appointment or following a discharge from a hospital back home? Ambulances can provide non-emergency transportation to members as long as the mode of transportation is medically necessary and is the most appropriate mode to meet the enrollee's needs, and the doctor has provided documentation to support the need. Enrollees who are being transported to and from a doctor's appointment or discharged from a hospital, who have no other means of transportation to a covered service, and who do not need or are unlikely to need medical attention during transport, will be transported by a non-emergency transportation provider other than ambulance. How will ambulance providers be reimbursed for providing non-emergency transportation services to members? To be reimbursed for non-emergency transportation services provided to members, ambulance providers must be a participating provider with our non-emergency transportation vendor MTM, or receive approval from MTM to provide the service, and non-emergency transportation via ambulance must be approved by MTM and billed directly to MTM. Are ambulance providers required to obtain prior authorization from WellCare for emergency ambulance transportation? Are ambulance providers required to participate in WellCare's network to provide emergency ambulance transportation to a member? Ambulance providers are not required to obtain prior authorizations for emergency ambulance transportation as long as it meets the requirements as outlined in the CMS manual and Medicaid handbook. Ambulance providers are not required to participate in our network to provide emergency ambulance transportation to a member or to receive reimbursement for providing emergency transportation to a member. How long do ambulance providers have to submit a claim for emergency ambulance transportation services? Ambulance providers have up to 365 days from the date of service to submit a claim to WellCare for emergency transport. For enrollees who are duly eligible for Medicare and Medicaid, are the MMA plans required to cover the Medicare coinsurance and deductibles for Medicare-covered ambulance transportation? MMA plans are required to cover the cost sharing for any Medicare-covered air or ground ambulance transportation up to the Medicaid allowable amount. For non-emergency transportation, the Medicare plan is primary payer and MMA is secondary. Stay Well and WellCare would like to thank you for all you do to support our members.